This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
And good afternoon. Welcome to Dr. Tom Roselle Live. I am in studio, and obviously I am not Dr. Tom Roselle. I'm Dr. Stephanie Pina, and I'm filling in when he's out traveling the world, educating everyone, just as we do every single Sunday here, taking your questions, going through those things that you might have questions on as far as health and wellness, what you've tried and applied, as Dr. Roselle would say, and how you can make health a do-it-yourself program. In studio today, I have one of the other docs from our office, and he's going to be your presenter this Wednesday night, June 3rd at 7 p.m., Dr. Brice Miller. And how are you doing?
Doing well, thank you.
All right. We're going to take over the show, hopefully do Dr. Roselle proud, and take some questions from you, too. If you want to give us a call and ask us anything, feel free to call in. The number is 888-630-9625. Again, that's 888-630-9625. And we're going to be talking about the same topic you're going to be talking about on Wednesday, which is a very interesting, undiseased, questionable disease. We don't really know what it is in conventional medicine because it covers just about everything, and they still don't have an explanation or example, but essentially that's fibromyalgia. And for those of you that have heard that key term out there, that's right, because it can be used as a key term without a really great explanation. Dr. Miller is going to be going over all the ins and outs of it, and just like we're going to start today, he's going to be doing that at the Roselle Center for Healing on Wednesday night. So if you're hearing things that you want to come and hear more about, or this applies to you, make sure you give a call to the office at 60. That's not right. That's 703-698 7117 to essentially sign up and reserve your spot. Dr. Miller, what is fibromyalgia?
Fibromyalgia, that's the question, right? What is this disease they call? The basic symptoms of fibromyalgia are just going to be your hypersensitivity to pain. That's what everybody associates with anything that people are experiencing, just more pain than they should, always in pain, some fatigue, some sleep disturbances. That's the general basic idea of what it is, but it can come with a lot of different symptoms and a lot of different things, a whole concoction of things ranging from digestive issues, irritable bowel problems. You can have anxiety, depression patterns. You can have issues with how you're processing, brain fog, problems like that. But the real question is what is this disease? And it's kind of overused, I think. It's kind of just a catch-all term that people are throwing around when they don't know what's going on. They just have all these problems happening, so they're just going to throw this term on there and call it fibromyalgia.
Well, I think, a lot of times people are coming in and they're also talking a lot about, chronic pain with it, the muscle pains and the trigger points and how you diagnose this and everything. But I think like chronic fatigue syndrome, IBS, a lot of these can cover so many things and seem so vague that, they seem as syndromes because they cover a lot of things instead of being an actual diagnosis. And the good thing of what we do in our office is technically we kind of break down the whole body and see what might be really causing that issue instead of worried about what the name of the disease is.
Right. We're less concerned with putting a name on something versus going through the body and breaking it down structurally, biochemically, and looking at stress patterns to figure out where the dysfunctions are happening and going after what's really causing the problem versus just labeling it as something else.
Well, it's interesting. I was doing a little research, and fibromyalgia has been around for a while, even without a correct or positive name. Fibro obviously meaning muscle, fibro meaning connective tissue, myo meaning muscle, and algia meaning pain. And, they used to call it muscle rheumatism a long time ago in the 1800s, and essentially they didn't know what to do with it either. They basically would think it was a mental disorder. They knew there was pain syndromes, and they didn't know how to treat it. And a lot of the times, they would go and try to adjust something, or they would give, just like we see now, a mixture of muscle relaxants and antidepressants and think it's all in the mind. And then if there's digestive systems, they think it's completely separate.
Mm-hmm. Yep.
When you see patients coming in for fibromyalgia, or they come in with these symptoms, and we're talking about that chemical, emotional, and structural standpoint, I mean, where do you start? Do you start with what they've done in the past or where they are now? Because we know that there's a lot of different triggers, and we were talking about this earlier, and we'll get into this. But where do you start with them? Where do you take them under the wing and start to kind of guide them in that healing process?
Yeah, whenever you see anybody for any condition, you always want to take them back to the first time they ever experienced any of these symptoms at all. So a lot of times you'll see with fibromyalgia patients there's a severe injury pattern or an infection that's happened or a psychological stress that's occurred that was happening at the start of their pain pattern. Sometimes you don't have that. Sometimes you'll just have a gradual onset of symptoms. But a lot of the cases you'll see will actually have a specific time where something happened to them, and then they just had this pain pattern develop. So, again, we're looking to figure out why it's happening. There's all kinds of different signs and symptoms, and so what we're going to be doing on Wednesday is kind of breaking down each of these symptoms and looking at what could be causing this to actually happen. Instead of calling the term fibromyalgia, we're going to break it down and see where dysfunctions could be happening symptom by symptom and kind of put it all together as a complete picture of what the body's actually going through and what's happening.
Right, because if we can kind of backtrace and see where the root of the problem is,
Correct.
That should start to help with everything moving forward, too, as well. All right, so that's going to be at the office. So if you want to sign up to see Dr. Miller then, you're going to call the office number, and you can also get a list of all the other upcoming lectures on rosellecare.com, ROSELLECARE.com. And I believe we have our first question, so we're going to go ahead and take Karen. How are you doing?
Oh, good morning. Thank you for taking my call. I spoke to Dr. Roselle about a month ago on the phone, and I had the flu. And I had gone to that Minute Clinic,
mm-hmm.
and I had told them that it was the first time I had the flu in 30 years. And that was the last time I got the flu shot. And anyway, I was really run down, and I was also battling some kind of sinus infection. Well, Dr. Roselle gave me some pointers on what to take, and the flu went away very quickly. But I was battling this sinus infection, and it was a little cough, a little kind of little phlegm.
Oh, the congestion that goes along with it. It's
yeah,
not going away.
Now it's like I look very good, I look healthy, but I'm wiped out.
Mm-hmm.
I get so tired. I can only go and do an errand maybe for an hour. I have to come home and take a nap. And I went into the cleaners the other day, and the lady suffers from severe allergies, like pollen allergies, and I never did before. And she said, "Oh, the pollen is awful. It's just awful the last 2 days." So I'm thinking maybe that's what I'm suffering from. And I was wondering if you could give me some great advice. I take a lot of homeopathic products. I eat very well, but I'm going on a trip to Newport, Rhode Island on Thursday. I'm flying up, and I'm really worried that I'm not going to have the energy.
Sure.
I'm just so upset.
Okay. Yeah. Well, absolutely. Well, hopefully you're going up there and you're going to be able to relax, because it sounds like the body's still.
No, we're going on tours.
Oh my goodness. Well,
like
that's somewhat relaxing.
Tour of Newport.
I've been to that area before. It's more relaxing than this area. So, well, definitely one of the things that I think you have to think of, especially in this DC, Northern Virginia, Maryland area, this past kind of spring going into summers, where the weather has been so fluctuating. We had different pollens and tree grasses and everything coming out at different times in our body. Just definitely not used to that. So what you're seeing is there's been higher sensitivity in most people coming in with, I would say, what used to be a version of between a cold symptom and almost like straight allergy symptoms. So they're either having the tired and the fatigue and either muscle aches all the way to the congestion or runny nose, and so, or then going back and forth between them. And one week it might be one way, and the next week it might be the other. So what you're experiencing is very common in this area right now. But I think what's happening is your immune system has done such a great job to try to bring things around, and good thing with proper eating and getting some exercise and a little bit of rest. Your body's trying to deal with the outside pollens, because obviously we can't make those just disappear. And we know that the weather's going to continue to go up and down. But one of the good things is that the fatigue that you're experiencing that kind of continues could be related to the fact that it needs more time to heal, because it's putting all the emphasis into boosting the immune system. Dr. Miller?
Yeah, when you see fatigue or things like that with your sicknesses, it's the same thing with an allergy. Your body's producing inflammatory compounds, and a side effect that is you're going to have some fatigue patterns and things like that because your body wants you to kind of take it easy while it's trying to fix things. So the same way your body responds to a flu is the way it's going to respond to a piece of pollen. It's going to attack it and think that it's a foreign invader, and so it's going to produce these inflammatory chemicals, and it's going to make you have that down feeling. But if you keep hydrated, that's also something you can do. It's kind of hot outside. You lose more water than you think you might be doing. Hydration is a key way to keep the energy up, but just letting your body kind of do its thing, and eating healthy is absolutely paramount to making sure that you can reduce your allergy symptoms, because there's all kinds of connections I see with people that will eat, grains or sugars, and then they're going to have a huge flare-up of allergies because your immune system is mostly in your intestinal tract. So if your intestines get inflamed and you amp all that stuff up, your body's going to start responding to all kinds of stuff. So keep the diet.
Should I eat quinoa and brown rice? Should I stay away from them?
No, I'm not too worried about that kind of stuff. I'm talking more along the lines of breads and
I don't
pastas that are like, refined carbohydrates. That's the stuff we're talking about.
And also in Chinese medicine, we look at foods that create more phlegm, which is basically kind of like the mucus and stuff they're producing. So dairy, heavy food, things that's going to be what the main things you want to stay away from. So right now, if you're still feeling fatigued, it's still time to make sure you're keeping a clean diet, which may be easier said than done if you're traveling. But you'll be in a little bit of a different area of the country, so that might actually help out a lot too. So make sure you get some relaxation time in there on your travels.
Oh, good. Okay.
All right. Thank you, Karen.
Well, thank you very much. I enjoyed the both of you. I've been to your lectures.
Oh, very good.
Great.
And you're both very good. But
we try.
Anyway, keep up the good work.
You got to keep putting in a good word for us with Dr. Roselle, if you guys want us to keep coming back.
Oh, great, yeah. Okay,
you.
well, you take care.
Great, you too.
Bye.
So when we talk about fibromyalgia, what's interesting too, and you brought this up where there might be old kind of conditions, whether they're trauma, pain, infection, and stuff in the past, the immune system's also playing a part of that because it's not allowing the body to heal, and that in itself might be increasing some of that pain and chemical sensitivity that, the body basically is just going, I'm not healing right, so I'm going to be overly concerned.
Correct. Yeah. You have that initial injury or infection where the body has gotten very amped up or stressed, and it puts out this big response to try to fix something, and sometimes the body doesn't quite know how to reset and go back to normal. So it stays in this heightened sensitization state, and that's one of the theories they have for the cause of fibromyalgia. This is central sensitization, which just means that your nervous system and body has become overly sensitive to signals, so say for instance if you hurt your foot because you rolled it over, and now your foot is more tender than it normally is because your body's making it aware so that you don't hurt it more. But that should go away over time, and sometimes that doesn't happen. And sometimes if you have enough of a significant injury or an infection or stress, it can go through your whole body, and now your whole body has become sensitized due to this inflammation and neurologic sensitization, and it doesn't reset itself like it's supposed to. And that's one of the major things we see happening.
Because we keep going back to, people want to treat the pain. I mean, obviously they don't want to be in pain, but pain in some ways is a signal to us that something is not right.
Correct.
And so just in this case, too, it's almost like the body's giving you that signal, but then it's taking it, 10 notches higher because it doesn't really know how to deal with it. It kind of constantly goes, it's just increasing. And then it's starting to affect the other systems, like you said, the digestive tract and your sleep cycle and your energy cycle and even mental, emotional aspects.
Yeah, like we talked about, again, there's all these other things that go on besides just the pain and things like IBS or irritable bowel syndrome. If we talk about the immune system, it's all in the intestinal tract. So if your guts are out of whack per se, you're going to have some issues, and that can cause the whole body to become inflamed and lead to this sensitization issue.
All right, we're going to be back in just a minute with Dr. Tom Roselle Live.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
And welcome back to the Dr. Tom Roselle Live Show. I am in studio live here with Dr. Brice Miller, and this is Stephanie Pina, and we are talking about fibromyalgia, as Dr. Roselle has called it in the past, the undisease, because it's a little bit of everything and a little bit of things that we don't understand. But the good thing is that when you're starting to treat the root cause and really address the main issues, you can start to see major differences. And as we started to talk about at the beginning of the show, when we look at different things that can create some of these issues and slow down really any kind of healing process, you'll hear certain terms come up over and over again. And with fibromyalgia, there is no difference. The words inflammation, adrenal stress, digestive health, they keep coming up over and over, and because we put so much emphasis on balancing those parts of the body in order to really help strengthen the immune system to help deal with some of these chronic illnesses, which you see being more prevalent nowadays. So Dr. Miller, are any of those basically to blame for fibromyalgia more so than the other, or is it really just a combination of everything?
And again, everybody's individual, so one could be more prevalent for somebody, whereas not necessarily for everybody. So one of those main factors could be sensitization for one person, or it could be their gut, or it could be some other things. But it just depends on each person individually. But a common theme we see with people that have chronic pain is digestive dysfunction and injuries and or high stress levels. Mm-hmm. Some other things they talk about that could be big contributors that's not often looked at, which should be, I think, is sleeping as well. So when you sleep, your body resets itself neurologically. It flushes the brain out with cerebrospinal fluid to kind of keep the inflammation levels down and kind of help reset everything. And a common symptom we see in these people is they can't get to sleep very deeply, or they have problems sleeping. And what that can cause on its own is systemic pain. I mean, that's a common thing you can see in people that have insomnia or problems sleeping. They start to get achy and have problems because if your body can't detoxify your brain, and there's inflammation going on up there, it can lead to all sorts of things. It can mess with the way your neurotransmitters are produced, which dopamine is actually not just for feeling good, but it's a big part of the pain sensitization pathway. So if your dopamine levels are starting to fall because your brain's inflamed, because you can't sleep very well, then you're going to have systemic pain. And there's lots of studies that showed people that were denied sleep started to have these pain patterns, and when they had their sleep restored, it went away. So that's a commonly overlooked issue, I think, that isn't getting enough attention is the sleeping.
And we were talking about how there's also this ability to have kind of co-infections and stuff going on at the same time when you have fibromyalgia. Restless leg being one of those that, can greatly affect people during the day, but also during their sleeping patterns as well, too. And, when people get treated for that, really becomes, muscle spasms, and they're using medications to kind of calm the body down. But the problem is that their sleep cycle is also off.
Correct. Yeah, and the sleep cycle, it can be off for lots of different reasons. Eating sugary things at night before you go to sleep can throw it off. A common thing we see, though, is again, it's this sympathetic nervous system. It's this fight or flight nervous system that has become overly active due to stress. So that's where that stress piece comes in. It makes your fight or flight mode go into overdrive, and then your mind starts running. And when you get to bed and try to lay down and close your eyes, your mind's just running and running and running, and you can't get down to that deep level of sleep. So you can draw it back to that stress piece as well. Okay,
we're going to try to get a quick phone call in before we go to the next break. Robert from Rockville, how are you doing?
I don't think it's too quick, but, let's try.
Sure.
I've got pain in my shoulder and elbow. And a neighbor of mine who had similar problems told me that there's a new technique called platelet-rich plasma injection and stem cell injection for painful joints. Where in the world is this pioneered? Is this Mayo Clinic or?
Good question. They may be doing it at multiple sites, so that's probably why. I mean, you're going to hear much more about stem cell injections, not only for pain injections, but even for organ function as well in the future. I think, again, with that, it would be great if we could do things to kind of open up areas of pain management without having to put more stuff into the body, because just like when you use any of the other injections, like cortisol injections, any of the topical steroids, pain medications, it's going to work for some people, and then other people it's not, even though it gets put into a kind of catch-22 that everyone should respond to it. And even if they're using your stem cells for it, it could be something that needs to be, manually adjusted or actually kind of worked on too as well to find the cause of it instead of just putting more stuff in there.
Yeah. This platelet-rich plasma stuff, how in the world does this work?
What I think the basic idea behind this stuff is it's just giving some nutrients and some things to help heal the area and kind of help take the pain down and kind of rebuild the area. But what it's not addressing is why is the area breaking down in the first place. So what you're going to do is you're going to get some relief, but it's going to kind of unwind itself because you're not going after what's really happening and what's causing the problem. So.
Yeah, and essentially also kind of trying to figure out, if we can get good blood flow and supply to an area, whether we're injecting it or you're doing something kind of manipulative to it, it should help the healing process. We're going to be back in just a couple of minutes after this break, and you're listening to the Dr. Tom Roselle Live Show.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Fibromyalgia with Dr. Brice Miller on Wednesday, June 3rd at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
I'm Dr. Tom Roselle, host of Dr. Tom Roselle Live. Did you know that your brain and nervous system controls your strength, vitality, and health? Do you want control over that? Then join me for Ageless Health 2015 on October 17th at Fairview Park Marriott Hotel in Falls Church, Virginia, for a day that will change your life forever. Check it out, agelesshealth2015.com. That's agelesshealth2015.com or call 703-698-7117.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
And you're back. And we're here live in studio, and we're ready to take your questions at 888-630-9625. And this is Dr. Stephanie Pina and Dr. Brice Miller on the Dr. Tom Roselle Live Show. And we are talking about fibromyalgia, which is the topic for this Wednesday's lecture at 7:30 p.m. If you are interested, or anyone you know, or you want to bring someone who has never been to the Roselle Center to see what these lectures are like, and you get a chance to meet the doctors in person, ask them questions, feel free to give the office a call to reserve your spot, because they fill up quickly, and we want to make sure you get your spot. We don't want to have you sitting outside the door going, man, I wish I'd gotten here a little earlier to listen to this, because I have a feeling it's going to be a pretty packed room for Dr. Miller. But you can call the office 703-698-7117 to sign up for fibromyalgia this Wednesday, June the 3rd, 7 p.m. Now, with our last question that we just had on treatment, what is interesting is, and we talked about how we're trying to get as much nutrients and blood flow and everything to these areas. When we're talking about chronic pain symptoms, when we're talking about digestive diseases, and everything else that's kind of going along with fibromyalgia, when we look at different types of treatments, whether it be chiropractic, acupuncture, nutrition, how is the best way that all goes together to help the person? Because we're always going back to treat that root cause, but at the same time, we have to make sure we're providing relief and getting results too.
Correct. Yeah. You'll see the type of treatment that we like to do is go after what's really causing problems. And the thing that we see with fibromyalgia in medical treatment pathways is they're using these medications, either pain blocking or anti-inflammatory or an antidepressant, which is going to help upregulate your serotonin or dopamine levels. They're trying to change and go after the symptoms of the person that's having the issues, versus trying to figure out why those symptoms are showing up in the first place. So when we look at the person going for treatment, it could be more effective for them to see an acupuncturist and do nutrition and do some adjustments. Some people need a lot more physical therapy and heavy nutrition. Some people respond to other things. It just depends on what we find in that evaluation of you, because it really comes down to what happened to you to cause this pathway to develop. So it's very specialized and created just for the person that's coming in.
Which really works great when you do have these issues and these chronic term pain issues. I can't talk. Of essentially when there isn't anything or even a source that we know of. So yeah, it is well individualized type of care, work on the whole body. Charlie, we're going to take your call. Thank you for holding on.
How you doing?
Good. How are you?
I'm doing okay. I have a hernia operation tomorrow, and in the recovery stage, I know they're probably going to give me some of those narcotic painkillers. I want to know if there's something else I can take instead.
Well, a lot of the times with the surgeries, because they are going in, is the shortest and least amount of time that you have to take them is always good, because they do want to prevent any additional injury and illness afterwards. One of the main things too that we kind of see people kind of coming in with issues post-recovery is that they try to do too much too quickly. So you want to try to stay as active as you can, but not to add in anything more. So when they talk about not doing any heavy lifting, not over, stretching the area where they were basically working, you want to make sure you're still able to function and move around, but you don't want to, this might not be the time to go out and run the marathon and to, go to the weightlifting class and stuff too. One of the things that we do a lot of in the office that's easy to get a hold of is homeopathically. You can use arnica right before and after the surgery to kind of help out with the healing response. And those are homeopathic tablets you can put under the tongue and take a couple of times a day that you can find at some of the local health food stores, and it's not going to interfere with any of the medication. But especially with the heat coming up too, hydration is going to be good, making sure that you're decreasing as much stress on the body as possible, because any kind of surgery, any kind of procedure is going to put stress on the body. So give yourself time to relax after that. Work on, eating well, getting the sleep that you need, being active but not overactive, and then just allowing yourself to have more of that healing time. It's probably going to be the best thing that you can do instead of trying to add in, anything else right now.
Yeah, sleep.
What about the pain, though?
The pain, you're initially probably gonna, if you're in severe pain, I've had some people that get those hernia surgeries and they can be really, really bad. So it's not, awful for you to have some medication, to get through that initial very strong pain pattern. But as soon as you can start to kind of wean yourself off of that, I would go that route. You could also look for things like turmeric compounds and natural anti-inflammatory compounds that'll also help with pain. There's not a lot of strong vitamins and nutrients for severe pain, really, so the best thing, again, is just to help the healing. So keeping inflammation low with a clean diet, getting good sleep so you can really start to heal and regenerate that area will be probably your best bet when it comes to that.
Okay, what I was thinking of was lesser of evils. Instead of taking narcotic painkiller, would it be better to take something like ibuprofen or Advil, something like that?
Well, one of the things you can always ask your doctor too, because there are sometimes reasons why some of the narcotics versus some of the over-the-counter medications may be better for your particular situation, and some of the lab work that they do before you go into surgery has to do with that. I think the best thing is just tell him that you don't want to be on medications for that long, and that you want the less that you have to use, the better. So that way, basically, he might be able to give you advice on what might work best for where you are too.
Okay, well, thanks a lot.
No problem. Not a problem. Let's take another phone call. Dolores? Hello?
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 This is Dolores. Are you talking to me?
I am. How are you doing?
Oh, all right. Thank you. I have fibromyalgia. I have colitis. I have edema. I'm always exhausted. I'm not on any medication for the colitis or the fibromyalgia. I'm tired all the time. And I really have to push myself. I don't know what to do at this point anymore.
Well, you definitely seem like the type of person that has to be at the lecture this week, that's for sure, because this is all about you.
I do want to be there.
Absolutely. I think one of the main things you just mentioned, and for everyone who's listening, it's a great example because, it's not just a pain syndrome. It does incorporate a lot of other issues as well, too. And the body's basically so tired because it's trying to deal with everything at once. It's kind of saying, well, should I work with the pain, or how do I treat the digestive issue? I think starting basic, come and talk to Dr. Miller or one of the docs at the office.
Yeah.
And
may I ask you one question? Do you take Medicare? Does your office take Medicare insurance?
The chiropractors are typically covered under insurance, and we have someone in the office that can help go through some of that billing and see if you qualify for anything. And there are also different ways where you might be able to apply some of the insurance credit you have, or use up some of the money that if you have a health savings account as well too. Sometimes we have people that we can put you in direct contact to that are in the office when you're in there too. So that shouldn't be the issue. We want to make sure that we get you healthy.
Oh, I know that. But I do have the Medicare and the Veterans Administration insurance.
Mm-hmm.
Uh-huh.
Well, one of the things, too, with what you're treating with fibromyalgia, and when you're looking at a number of different things going on, is that you want to make sure that you're really seeing how the body's going to respond. And sometimes it starts off something very basic, and you probably been dealing with this for a while. So,
I have.
Yeah, a lot of this stuff isn't quick overnight types fixes because we didn't get that way overnight either.
Yeah. And diet, as far as that's concerned, is very poor because I'm afraid to eat so many things because of the colitis.
Exactly. Yep. So, I mean, that's when you really have to sit down and, talk with Dr. Miller about how do we help with the pain response, talking with Sue about setting up the proper diet for you so that we can introduce foods that doesn't affect the colitis, that you can get the nutrients from. Because if you're not getting the foods, we can't give you even supplements that are going to go through if your body's not absorbing it. So we have to really make sure that we come up with an individualized plan for you.
Uh-huh. Okay, I will be there. What time is it? I didn't tune in at the time.
It's going to be on Wednesday night, and it's going to be at 7:30 p.m.
Okay.
And then the only thing you got to do is just call our office, which is at 703-698-7117, and just tell them you're going to come in.
All right. Thank you so very much.
No problem.
All right. Bye-bye.
So let's also get into the fact that, there are some diagnostic criteria with this, as far as how many trigger points, and that has to be, you have to find pain in the 4 different limbs, and the trigger points are kind of located around the body, not necessarily over joint, because joint pain is not necessarily fibromyalgia, it's in the muscle itself. And what I always thought was interesting as an acupuncturist is that a number of the fibromyalgia, tender spots or trigger points actually line up with acupuncture points, and they're kind of like embedded into the muscles themselves too. But when we look at, functional muscle testing and lab testing, they might not always give us the most direct answer. Sometimes you actually have to get the best information from what the patients are going through, what they're experiencing. Anything you want to follow in with that?
Yeah, the classification, there's have to be certain pain patterns and certain areas have to be affected, and it's just a way for them to label something. They're just trying to make sure it's the whole body. For fibromyalgia, it's going to be a systemic issue. It's not just you hurt your lower extremity and both your legs are kind of achy because you have some issues down below with whatever, could be nerve compression or something like that. It's the whole body is affected by this condition. So that's what they're just trying to classify. But again, the classification and labeling a zebra isn't what I'm looking to be focusing on, because I want to figure out why it's happening, what's going on, and what's really causing the situation for this person. So,
and I think what's interesting, and we go back to talking about stress and inflammation and poor diet and lack of exercise and trying to constantly updo ourselves and keep getting that next goal, putting even more stress on the body and working on the adrenals and our sleep patterns. All those things really do decrease our healing response and then also help create other issues as well too. So we don't necessarily always see things show up nice and pretty in one area of the body. We usually see it affect multiple areas of the body, and fibromyalgia is no different. That's going to be the topic this Wednesday night at the Roselle Center for Healing with Dr. Brice Miller. And also, if you don't remember, coming up in October, which Dr. Miller and myself will also be speakers at, is going to be Ageless Health 2015, and we are going to be talking about how the brain affects the rest of the body too. So it fits well into this subject, but it also fits well into any of the things that you hear here on the Dr. Tom Roselle Live show, as far as how the brain reads the rest of the body and the communication from the body back.
Yeah, there's a lot of research and information coming out talking about the connection between the intestinal system and the brain and pain and your mood and all those things. There's a very extensive connection between those two systems. That was my last presentation, last time I was here talking about that stuff. But again, it all relates. You have that same type of stuff happening in fibromyalgia. You have that inflamed intestinal system, get that leakiness in your intestines, get that systemic inflammation, that blood-brain barrier starts to leak, get inflammation up there, can mess with your centralized pain receptors, so your whole body starts to become hypersensitized because of this inflammation, and now you have this pain pattern with that gut issue and everything else happening. So lots of stuff, lots of details. Lots of things can happen. So we'll break it all down for you on Wednesday. We're going to kind of go through what it is, go through each of your individual symptoms that are showing up with fibromyalgia and kind of break down why they're happening and what could be causing these things, instead of looking at the whole thing as just fibromyalgia as a disease.
Right. And also talking a little bit about kind of some of the different theories and stuff are out there, and how we kind of start to think about it from our minds too, since we're not just going by, a lab or an x-ray, or, like I said, it doesn't always fit into the perfect little box and pattern as well too.
Yeah, one thing also that you make note of is the blood sugar thing. I think is something that needs to be talked about and looked at as well, because when your body has blood sugar issues, it's a big stress on the system, as well as that sugar is inflammatory, so that diabetes and those types of things can cause diabetic neuropathy, which is which is going to feel just like you have muscle spasms and pain in the limbs and things like that. A lot of these medications that they're actually giving to treat fibromyalgia are diabetic neuropathy pain medications. So you got to look and see, are you treating fibromyalgia, or are you treating diabetic nerve pain because the person has all these metabolic issues, and what's really causing it? Again, going back to finding out biochemically, structurally, and stress patterns, what's really causing the issue.
All right, we're going to try to get Bernice from Arizona. How are you doing?
Hi, I'm doing fine. How are you guys?
We're doing good.
Hey, I was just wondering if the speaking event you guys are going to have could be aired in the future on radio so that us that aren't in Boston area could listen to it.
Well, you know what's interesting is I believe it wasn't last year. I think the previous 2 years, a number of the speaking events that we did in-house were actually recorded while we were talking live, and they actually put them up on the website. So I can't remember if you can get them through the YouTube, the Dr. Tom Roselle live YouTube station, or you can get them through our website, which is rosellecare.com. But you used to be able to order the recording so that you could actually see some of the doctors as they were presenting in our clinic. And that's probably going to be the best thing too, because it also gives you can see the slides and you can see the information right in front of you and kind of play it along as you go back and forward and really get as much information. And there's about, if I remember correctly, I think there's between 15 to 20 of those that we actually recorded from a number of different topics, from herbal medicine, hypertension, chronic pain. I think there's one on the immune system. So off of our website or even online on the YouTube station, you should be able to find some of the ones that we've talked about too.
Okay.
So, yeah.
And can you tell me a little bit about iron deficiency and just about anything about iron deficiency?
Okay, yeah, sure. When we're talking about iron deficiency, what's interesting is it can be part of an anemia. It can be a decrease in iron overall. But what's always funny is we end up going to the blood source right away. We think about what's going on with the blood because iron is really important for carrying oxygen and binding oxygen to get to the rest of the body. So a lot of times people, if they don't have any issues with, say, hemorrhaging, or like with women who have really heavy menstruation that may be bleeding really heavily and losing a lot of blood loss, they may lose iron through the blood loss sources. But essentially, you have to be able to absorb iron and then also put it into the system as well, too.
Yeah, a common thing we see in people is they don't have a very strong digestive system. The stomach doesn't produce enough acid due to stress and all these other things, so you can't break down these minerals like iron and calcium, magnesium, and these things very well to absorb them. So sometimes it's simple as helping with some digestive aids to help absorb the iron that you're eating in your food better.
Like everything, not necessarily adding in more iron is going to be the best way either. So,
correct.
All right, we'll be back in just a few moments.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
105.9 FM and AM 630 WMAL.
And welcome back to the Dr. Tom Roselle live show. This is Dr. Stephanie Pina and Dr. Brice Miller, and we are live in studio talking about fibromyalgia. And it's the undisease that we keep mentioning that has so many different components that we're not as concerned about how you're necessarily getting diagnosed with it, but what was the cause? What was the beginning? How did it start it all? And why aren't you healing properly? You know, there's a number that says 2 to 8% of people have a diagnosis of fibromyalgia, but up to 75% of people may be undiagnosed, mainly because it doesn't fit into that one category. And you can't often see fibromyalgia linked together with chronic fatigue syndrome, sleep issues, digestive issues, adrenal deficiencies, and also it can affect everything from the endocrine system to the digestive system to the way we think and not think. So this Wednesday night, June the 3rd at 7:30 p.m. at the Roselle Center for Healing and off of the Beltway, you can come and listen to Dr. Miller talk about fibromyalgia and get some real good insight on what we do to treat it, how you can try to help to manage it, and really be able to start that conversation up so that you can learn about what kind of options you have as far as treatment goes. If you're interested in registering, you have to make sure you call the office at 703-698-7117 to reserve your seat, because this one's going to fill up fast. Dr. Miller, fill us in on what you're going to be talking about in a little bit more detail so that the people can get really excited about your lecture.
Okay. So like I said before, the basic gist is we're going to go over fibromyalgia and kind of talk about what is classified as, what's included with that syndrome, kind of what the traditional responses and treatments are, and then we're going to break down each of the symptoms piece by piece and kind of put together what could be causing this symptom to show up in the first place. And then as we look through the symptoms, we'll see there's patterns of similar causes, and you can kind of put the picture together to see how a lot of these things can happen together due to functional problems. So again, we're trying to look, instead of looking at pathology, trying to, block a process or, stop this from happening, via drugs or surgeries, we're trying to figure out functionally what is causing these symptoms to show up. So we'll go through all those different symptoms and break down what could be happening at the end, kind of give you some ideas about ways we can go after that stuff and kind of treat it for you.
Yeah, no matter what we talk about in the in-house lectures, make sure that you know that they're always free. We always like people to bring guests and stuff because, if you're going through this, that you're probably this disease or illness or whatever you're going through is probably affecting those around you too. So the more that you know about your treatment options, whether they be chiropractic, acupuncture, nutrition, a combination of them, and then all that working with conventional medicine as well too, or by itself, the more you know, the more you're going to be educated, the better actually your healing response is going to be, because you're going to be part of our team as well too. And that's what a lot of these in-house lectures are all about, and also what we do here on the radio show every week.
Yeah, it's good to bring people with you as well, because like you can kind of already tell, we're going to go through a lot of data, a lot of stuff, and so having more people there to hear it, and so you can talk about it and kind of maybe hear different things and put the pieces together better, but lots of stuff to discuss, so the more ears, the better.
So the Dr. Tom Roselle live radio show and our in-house ones are going to be like the water cooler discussion time. Like, did you go yesterday? Did you see Dr. Miller? Did you understand what he was talking about, how the gut and the brain all connect together? We're going to be the live topics, I think, at work and at the family discussions the next day.
That's good.
So fibromyalgia is going to be the talk, but as you know, you can also go back and listen to any of these radio shows on the Dr. Tom Roselle channel on YouTube, as we mentioned earlier, and some of the recordings from previous events that we did and lectures as well in there. October 17th is Ageless Health 2015, the mind body connection, dealing with the brain. I can't even get the right ones down. We've already gotten our topics. We're both going to be speaking on that day, and those of you that have been there before know exactly how informative that day is. But these smaller lectures lead up to that, and it also is a great way to come and see some of the doctors that you hear on the radio show live in person and ask them questions, because a lot of the times we hang out afterwards and really can direct some questions and answers towards your particular illnesses and stuff as well too, because some of the stuff that we don't get a chance to ask and answer on the radio show get brought up at the lectures as well.
Yep, I like to hang out for a while afterwards. You can ask questions in front of the group, but I also hang out, so if you have personal questions, you can feel free to come up and talk to me. I'm happy to answer anything you have.
Well, we're going to be filling in for one more week for Dr. Roselle while he's gone, and I believe next week I am going to be on with him, and basically we're going to be talking about the heart. But this Wednesday night, Dr. Miller, come in and see him at the Roselle Center for Healing, and you can call into the office to make and reserve your spot, 703-698-7117. Thanks again for listening to us, and we'll be back later.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.